Just as travel showed some signs of revival, the threat of a new variant is back to haunt travelers. From mandatory testing to quarantine, several curbs are back. Here's all that you need to know if you wish to travel outside of India, or if you're expecting anybody from outside of India to your country.
The invisible enemy is back in a scarier avatar with over 30 mutations. Amid Omicron threat, centre and states are rushing to contain the mutant. In a mega move, the centre has put brakes on full resumption of international flights. Aviation watchdog DGCA, which fixed 15th of December as the date for restarting international flights, said it is watching the situation and a new date will be notified in due course. Maharashtra has made 7-day institutional quarantine mandatory for flyers from at-risk nations. Flyers will be tested 3 times on the 2nd, 4th and 7th day of their arrival. All positive passengers will be shifted to the hospital. Negative passengers will be further subjected to a 7-day home quarantine. Interstate flyers need full vaccination or recent negative RT-PCR test. For interstate flyers, negative RT-PCR test is a must.
There are more than 50 booths that have been put up where RT-PCR tests are being done. Apart from that, there's a waiting lounge for people to wait in where, if the testing really takes a while, they'll be asked to wait. Also, for people who have connecting flights, if they are in transit, then for them also antigen tests have been put in place.
Delhi has made testing mandatory on arrival. If the report is negative, then the passenger will be subjected to a home quarantine for 7 days and get tested again. All positive flyers will be admitted to hospital.
There's a separate room in the airport which has been made where all the passengers coming or will be asked to sit. The test will be done and they'll have to wait till the time the result does not come. Now, typically, the result takes anywhere between 5 to 6 hours, which means that your flight will take it longer. It will take you longer to come out of the airport.
The new norms spell hassle for flyers who are now made to wait for hours for test results and brave long queues at airports.
कोई गाइडेंस नहीं थी हमको कि आपको पीसीआर टेस्ट कराना है, और नहीं तो हम लोग पहले ऑनलाइन बुक करा के आते। उसके बाद 2 टेस्ट हैं यहाँ पे, एक है नॉर्मल टेस्ट और एक है रैपिड फायर। नॉर्मल टेस्ट लाइक वो ले रहे हैं 8 घंटे, और जो रैपिड फायर है वो 1 घंटा बोल रहे हैं, बट 1 घंटे में किसी को रिपोर्ट दी नहीं। तो अंदर काफ़ी लोग परेशान हो रहे हैं कि बच्चों के साथ छोटे बच्चे वेट नहीं कर पा रहे, बस खाने को कुछ नहीं है।
The WHO, meanwhile, opposed blanket travel ban, calling them ineffective to curb the virus threat. With Vidya and Aishwarya Paliwal, Bureau Report, India Today.
Dr. Samiran Panda is an ICMR scientist and he's also the head of ICMR's Epidemiology and Communicable Diseases Division. He's joining us live now. Thank you for your time. Dr. Panda, I want to begin by asking you, what do we know just yet about Omicron? And the big question on everybody's mind is that, are the vaccines that are with us right now that we're using in India and outside of India, does it appear that it's going to help us get protection against severe disease caused by the Omicron variant?
All right. So there are 2 or 3 components to the question that you have posed. First of all, Omicron variant of SARS-CoV-2 infection, and the virus which causes COVID-19, we are yet to understand the total clinical picture that could happen following infection. But the initial reports that we have received from South Africa and other countries do not indicate that there will be a severe form of the disease. Of course, if somebody is elderly or somebody has a comorbidity, we don't know what would be the clinical picture in them. However, assumption that Omicron would cause severe disease won't be right, an assumption, because this is a new variant. It is now known globally, and mostly from South Africa, based on the data obtained from there, that it is more transmissible. But any variant which is transmissible does not necessarily become fatal. So,
okay. Dr. Panda, looking at how this disease, has been wreaking really havoc across countries, do you think that we already have the variant in India there is a possibility that it's just a matter of time before it's detected, but we do have this variant already.
Well, of course, if one sees that the first report was from South Africa, the report was on the 9th of November, and then 24th of November and 26th. During that time, WHO declared this as a variant of concern because of the multiple mutations and the transmissibility. So during that time, many travels have happened all over the world and from and within South Africa. So one would not be surprised if this variant is detected within India. It's just a matter of time, of course. But it should not necessarily cause a panic because majority of these infections might be asymptomatic or might cause mild diseases.
Yes, I asked you this question because a lot of people are just waiting to hear this bad news of the variant being reported in India. Just to clarify that nothing to be shocked, nothing to be surprised about. There is a possibility that we have this variant in the country already, isn't it?
Yes, I will say that in public health and even at the individual level, we do much better if we get news with its right perspective and if we do not get panicked. Because, the government of India and India as a country is now well poised, drawing upon the experience of the first wave and the second wave, and the INSACOG, which is the mechanism of the platform, to do the genome sequencing and to figure out if there is Omicron. We are well able to detect its presence early, number one, through surveillance and also through sequencing. And the information that we have globally obtained around this variant, we should be able to handle it very well. So I would say that the panic is not going to help us. Secondly, it is the same virus, so we know how does it spread, and COVID-appropriate behavior would help us. For example, use of mask and hygiene, and to avoid mass gathering, which could serve as a super spreading event. That should be avoided, and we should go ahead and get our vaccines.
Yes, Dr. Panda, I want to ask you, because you also are a part of the discussions that are undergoing when it comes to boosters in the country. There is waning immunity. I don't think anybody is in denial about that. What I want to ask you is that you did say there is a possibility that this variant is also getting neutralized with the existing vaccines. Should there not be an immediate rollout of additional doses in India, as you're choosing to call it additional doses and not boosters, at least for the immunocompromised population?
The logic for booster, when we say booster, we are trying to boost up the immunity that has already been formed. And if somebody has not been able to mount enough immunity after the 2 doses, for that individual or for a special subgroup, one could think of, administering a 3rd dose. But the discussion around that should be disjointed from the Omicron, because we do not know yet whether the presence of Omicron would require a vaccine, because we must remember that these vaccines against COVID-19, they are disease-modifying vaccines. They are not infection-preventing vaccines. So if we want to, stop the spread or break the chain of transmission of the virus, then it's the COVID-appropriate behavior which we should focus on.
Yes.
In the meantime, we cannot afford to lose the public health priority and the focus, which requires or demands, covering adult eligible individuals as much as possible and as quickly as possible. At least 80% of the eligible adult population should be covered by the vaccines. And the vaccines that we have been using in India now is Covaxin and Covishield. And Covaxin being a whole variant killed, vaccine platform-based, development, then in all probability, it should be able to, mount a better immunity. But that's all about scientific discussion and conjecture. But
when will we have a decision on boosters and additional doses, sir? When can we expect a decision?
The decision is with, first of all, the advisory group is National Technical Advisory Group on Immunization and the Immunization Division. But this discussion should not take away our attention from the regular vaccination program. And if we have any hesitation or, relaxed attitude towards going and getting our 2nd dose on time, that would be absolutely wrong.
Are you all really worried about the 2nd dose coverage in the country? It's not even 50% just yet.
So that's why it's so very important for the media like yours and everybody in the society, and the community engagement and involvement of the community would do the much needed, the boosting in terms of our enthusiasm to go ahead and get our, second dose of the vaccines. Delaying it won't help us at all. So vaccination and vaccination plus initiatives. For
what
example,
is the eligible population, Dr. Panda, for the second dose? Who are these people? How many of them in the country just now who are supposed to get a second dose? They're due and they've not gotten it.
So it's adult individuals. We, of course, cover the healthcare professionals, frontline workers, and those who have comorbidities. And even within the adults, we don't know if somebody has, unrecognized comorbidity. So it's always about the adult individuals. For example, people do talk about the vaccination of children, but I would say that the parents of the children, the teachers in the schools.
But how many people, Dr. Panda, have not got the second dose of the vaccine? They're due to get this shot, but they haven't. How many people in numbers?
So absolute number you can always calculate. Now we are about 33 to 35%. We have received the eligible adult individuals, in India. They have received the second dose. So I would say that our focus and public health priority should be, bringing as much eligible individuals under the cover of second dose of the vaccinations as quickly as possible. And that's 80% coverage should happen.
My last question to you, Dr. Panda. Many epidemiologists all over the world are against travel bans. They say this is not going to stop the infection. In all likelihood, the variant is already in your country. What do you have to say? What is the ICMR's position on this? And what's your understanding of the situation as an epidemiologist?
The travel ban would not achieve what we wish to achieve, because the banning, of course, comes with, stigmatization. But if you look into the way things evolved, it's South Africa and their ability to identify the genome sequencing at the earliest. And that's exactly what we are talking about. The early detection through surveillance and sequencing. That is what is required. Because the viruses don't need a passport, and many of the virally infected individuals who have asymptomatic will remain in that. And the spread would happen. So it is much better to know the presence and then try and understand how is the clinical situation evolving. So banning has never helped. What it does is to help buy some time. But if a country has a system in place, it is much better to know how is the infection evolving or getting transmitted in a particular setting, and then knowing its clinical picture in full form. And does it require treatment or home-based quarantine is good enough? All those can be figured out.
Okay.
The more we move ahead with the time.
What about genomic sequencing? Has that increased in the country? Because there was a lot of concern about not much sampling, not much sequencing being done. Just do tell us about the kind of increase that we've seen in sequencing in the last few days, given that this center has told all states that you must, in fact, surrender at least 5% of the samples. And, of course, samples of positive patients coming in from high-risk countries who've tested positive.
Of course. So I will say now India has really ramped up its sequencing, ability and the mechanism. So we should all, have our faith and trust on the system, which has really ramped up. And we are well poised in terms of our ability to sequence. And the RT-PCR tests, which we are using now, and even the rapid antigen tests, they are not going to miss out any infection. There was a panic. So no need of such panics. And I would say that we should all adhere to the, COVID-appropriate behavior, and we should move ahead with our vaccines, and we should not panic about RT-PCR test or rapid antigen test not being able to detect the infection. That's not true.
Okay, so there needs to be no modification to any of these tests? They can detect the Omicron variant?
No, the Omicron variant can be detected through the existing diagnostics that we have now in India, which is being, deployed as a part of the ongoing program.
All right, Dr. Samiran Panda, thank you so much for your time and your perspective on an important story. Travel bans don't work is the word from the Indian Council of Medical Research. Dr. Panda also telling us that both the tests, the rapid antigen test as well as the RT-PCR test, continue to be effective and will detect the Omicron variant if at all it has entered India's shores. Meanwhile, let's talk about the kind of tutu meme that we're seeing between the centre. And this is, of course, versus the Maharashtra government over some new guidelines on Omicron. The centre, remember, was very upset with the kind of guidelines that Maharashtra government has brought about. Now, the Union Health Ministry has shot off a letter to the Thackeray government for imposing forced quarantine in the state, saying that really is not in sync with the centre's guidelines. In the SOPs laid out by the Maharashtra government, a 7-day institutional quarantine for all international travellers from high-risk nations has been mandated. Centre, on the other hand, in its guidelines had said that travellers from at-risk nations will need to take an RT-PCR test on arrival. And if tested negative, they have to undergo home quarantine for 7 days, but not for everybody. This should be followed by a retest on the 8th day. The centre has urged Maharashtra government to implement uniform guidelines. Every single state is on the guard. Delhi too has issued some Omicron guidelines. Let's take a look. Passengers from high-risk nations will have to undergo mandatory COVID testing on arrival is what they're saying. If negative, home quarantine for 7 days. And if negative again, you monitor the situation for 7 more days. You don't have to necessarily be in quarantine. Well, self-monitor for 7 more days if at all you are negative. If you're positive, quarantine at a designated hospital or isolate. Sample to be sent for genome sequencing, which is required. That's what the centre is saying. And those below 5 exempted from testing. Symptomatic children to be tested. So children don't have to undergo testing unless and until they're showing some symptoms of the infection. This is what the Delhi government is saying. Travel bans, and there is a raging debate about ban on international travel from countries that are high risk and have reported Omicron. 19 of them approximately. Well, the World Health Organization is absolutely against travel bans, saying that South Africa is being penalized for making the world wake up to the new threat. India, meanwhile, is waiting it out. Here's more.
Nations are rushing to close borders to African countries. Many European countries have suspended flights from South Africa and some of its neighbors. Japan has blocked arrivals from all countries. Is the sudden ban fair? Will it stop the transmission of Omicron? The WHO says countries are jumping the gun. There is very little evidence of Omicron's volatility to merit such drastic measures.
WHO recommends that countries continue to apply a risk-based and a scientific approach when implementing travel measures, in accordance with the temporary recommendations of the 9th Emergency Committee. And it is important to note that every travel measure should be always weighed, and that countries can do a lot already in terms of surveillance and sequencing.
WHO, in fact, feels that South Africa and other affected countries need to be applauded.
South Africa and Botswana should be thanked for detecting, sequencing, and reporting this variant, not penalized. Indeed, Omicron demonstrates just why the world needs a new accord on pandemics. Our current system disincentivizes countries from alerting others to threats that will inevitably land on their shores.
Many virus experts agree with the WHO that travel bans, they say, serve little purpose.
I don't think that shutting down borders is necessarily the solution to limiting entry of a virus. It can do that, but it's not something that's sustainable. However, testing and tracking and making sure that we identify infected individuals and their contacts is something that we can pursue as a public health strategy.
But a world hit again and again by various COVID mutations is not taking chances.
When you diminish or stop or block travel from a particular country, there's a reason for that. It's to give you time to do things.
The chorus for a ban on international travel now is only growing after Delhi, Maharashtra has also approached the centre asking them to ban flights from countries that have been affected by Omicron. But the government of India is right now adopting a wait-and-watch approach, given the fact that the World Health Organization is absolutely against it, and the scientific community also has apprehensions around travel ban. In New Delhi, Sneha Murdani for India Today. The World Health Organization has warned that Omicron coronavirus variant, the fifth variant of concern, poses a high risk of infection surges around the globe. That's possible. The variant could lead to severe consequences in some regions. At least 19 countries have registered Omicron cases. Here's a ground report from South Africa, where the virus was first detected.
Omicron has spooked the world. The super mutant is spreading fast. At least 19 countries have registered Omicron cases. The fast spread of the virus has prompted many nations to shut their borders to visitors from high-risk countries, including South Africa. Omicron, a coronavirus variant with around 50 mutations. In South Africa, it was first found in Gauteng province. Today, the city of Tshwane in Gauteng, just 85 kilometers away from the South African capital city of Johannesburg, accounts for more than half of the country's infections. India Today visited Johannesburg to get the real picture on the ground.
This is OR Tambo International Airport, and as we can see, well, there's not many people that are leaving at this very moment, as a lot of them will of course departing, you know, on Saturday and Sunday. But this is just a drive-through through the airport here at OR Tambo, and it's quite clear that sooner or later we are going to be seeing more people, of course, leaving to go home after the Omicron variant was discovered here in South Africa.
While a sense of normalcy still persists on the streets, there is an underlying fear of the situation getting worse.
This is Voortrekker Street, one of the main economic streets here of this part of Johannesburg, and it's quite clear that it is very busy at this moment. But what a lot of people are going to be worried about and questioning is whether this will change, whether this will be very quiet, whether this will be less than what we see right now, when if the COVID-19 cases continues to rise.
The Omicron surge is a big concern for the migrant population, away from home in search of a better standard of living.
जब से कोविड का अनाउंस हुआ है, जब से बिजनेस डाउन से डाउन होता जा रहा है और बिजनेस में कोई इम्प्रूवमेंट नहीं है, कस्टमर स्केर्ड हैं और यहाँ हम सरवाइव नहीं कर पा रहे हैं। अब हम ये सोच रहे हैं अब हमें क्या करना है, किस तरीके से हम अपनी फैमिली को सरवाइव करेंगे। लॉट ऑफ प्रॉब्लम्स हैं यहाँ पर।
South Africa witnessed panic buying when the last lockdown hit the country. Now supermarkets have restocked in case President Cyril Ramaphosa announces another lockdown.
The people might come more and buy some more fruit and veg to boost their immune system. We'll have to wait and see what happens. That did happen in the other times. The people came and they did a bit of buying extra. People aren't panic buying anymore and that type of thing. But let's see. It should affect it, but not really anymore.
I'm standing here at Netcare Lakeview Hospital here in the eastern part of Johannesburg. The hospital has said off the record that they are very prepared for the Omicron variant, which is going to start taking effect in the next few weeks. So the question we have to ask ourselves is government, are the private hospitals like this over here prepared for the variant, and are they ready to go ahead and deal with the influx of patients that are going to come? Well, that's all we have for you here. My name is Faraz Patel. I'm reporting from Johannesburg, South Africa for India today.
The question on everybody's minds really is, how is Omicron different from the previous variants of concern? Are the symptoms of Omicron really different? The answer to that is yes. What are the new symptoms then? Tiredness, scratchy throat, mild muscle ache, dry cough are the new symptoms that have been seen in those people who've been diagnosed with the Omicron variant. How is it different from the previous symptoms? Remember, the first symptoms of COVID-19 that we've been talking about for 2 years almost now: loss of smell, taste, cough, symptoms that have not been seen yet in patients who've been infected with the Omicron variant. Will RT-PCR tests help diagnosis? Yes, says the WHO. Yes, says the Indian Council of Medical Research. Just now, the ICMR says even the antigen test will work. Does it cause more severe disease? The WHO says they're not clear about this yet. From what it appears, it's not really causing more severe infection. Does it cause more infections in terms of more transmissibility? Yes, it appears, but the WHO says it is still unclear to say so definitively that it is more transmissible.